Good morning, everyone. My name is Melanie Chasteen, and I am the Director of Community Engagement at the Texas Campaign to Prevent Teen Pregnancy. Thank you for joining us for this webinar, which will cover teens and birth control. We are extremely excited to be hosting this session today, and based on the number of folks who registered, it's definitely a topic of great interest. Before we get into the content of today's webinar, I want to share a few tips for using the webinar platform and a bit of background information about the Texas Campaign. First, we have muted all participants to help reduce background noise, but we welcome your participation and questions using the question and answer function at the bottom of your screen. If you have a question for one of our presenters, please submit it using that tool. We will have time for questions at the end of the webinar. Also, we will email a PDF version of the slides to all participants following the webinar. In addition, both the PowerPoint deck and an audio recording will be on our website, txcampaign.org, by the end of today. Finally, the Texas Campaign relies on data to inform our work and future programming. We ask that you share your feedback via a brief survey that we will email you at the conclusion of the webinar. For those who are seeking social work CE credits, this evaluation is required. Again, I want to extend a warm welcome to our partners and colleagues across the state. For those who may be engaging with us for the first time, the Texas Campaign is a statewide, nonpartisan, nonprofit organization dedicated to reducing teen pregnancy through research and data dissemination, advocacy for effective public policies, strategic collaborations, and training and events. We have the privilege of working with a diverse set of youth service professionals and providers such as healthcare providers, educators, social workers, elected officials, and many more. As a small organization with a statewide reach, we started leveraging the power of webinar technology this year to grow our engagement efforts. This is our third webinar of 2019, and we have a handful more planned for the rest of the year. More information on those will be out shortly. Last, but certainly not least, I'd be remiss if I didn't mention that we are celebrating our 10-year anniversary this year, and I've outlined a number of ways that folks can get involved, from following us on social media to giving $10 a month to telling us about the sex ed myths that you heard growing up. More information can be found at txcampaign.org/10. And now, without further ado, I'd like to turn it over to our speakers, Dr. Selena Mostajabian, Darren Gieslin, and Elizabeth Torres.
Good morning, everyone. This is Darren Gieslin. I work at People's Community Clinic as the Health Education Supervisor. If you haven't heard of People's, we are a nonprofit, federally qualified health center who is in Austin. We have a couple of clinics here. We're a pretty small clinic, but doing a lot of really amazing things. One of the most important things I think about our clinic is our mission, and that is to serve the underserved, uninsured, and also those who may not have residential status. We provide health education to most of our patients, especially regarding family planning services.
Good morning, everybody. My name is Selena Mostajabian. I'm an adolescent medicine physician working at People's Community Clinic. We have a section specific for adolescents. Our teens come in, they have their own separate area, separate providers. And I wanted to thank Texas Campaign for giving us the opportunity to do this webinar, and thank all of you for tuning in this morning.
Good morning, this is Elizabeth Torres. I am a medical assistant and I do work in the adolescent department.
All right, so this morning we will be covering an overview of birth control and funding resources for that for teens. We're going to talk about, is this an area where teens even need help with? Are there effective and affordable methods available to them? How do you bring up this topic with the teens that you work with, teens in your family? We'll talk a little bit about specifics of safety of hormonal options, and at the end, we have some online resources for you all that you can explore on your free time. All right, but first we're going to see what you guys think of these fact or fiction statements. Okay, so you should be seeing these. So first thing is, I'm a guy. Cannot buy Plan B for my girlfriend. All right, so most of you correctly say this is fiction. Of course you can buy that.
This is a common one we hear from our patients. But it looks like you're all with us.
Nobody's into sci-fi, okay. Probably the number one concern we hear from our patients, weight gain. Okay, so about 15% of you guys think this is true, and there may be some truth to that. We'll go over that.
We hear this one a lot too. Younger women are worried about what's going to happen to their kids later, or they've been told that they shouldn't get on birth control because it'll affect their fertility in the future.
And we even hear some of our patients say, I like birth control, I want to get on it, but let me have my first kid first, and then I will get on it.
Yeah. But it looks like you're all with us and knowing that that is fiction. And many of our patients don't know that birth control does not prevent STIs. So this is a good one because we always have to remind them this is for preventing pregnancy, not for preventing STIs.
So this one is probably the one that scares our patients and their families the most. They worry that if they are not getting a period every month, there's something wrong with their body, it's unhealthy, it's unclean. So we do a lot of counseling regarding this.
And it's not just for teens. I spend a lot of time talking to 40 and 50-year-old women about how their period works. The last one, there's some misunderstandings that you can't get an IUD until you have kids.
And sometimes this has been perpetuated by providers as well, that they feel uncomfortable placing an IUD for a teen that has not had kids yet. So we can talk about this later as well. So congratulations, you guys all passed that one. So we're going to quickly cover some statistics. In general, over the past 25 years in the US, teen pregnancy rates have declined by close to 60%. So now we are at about 43 pregnancies per 1,000 girls aged 15 to 19. So this includes all pregnancies in all girls. But when we look at teens who are having sex, it's about 100 pregnancies per 1,000. The majority of these pregnancies end up in live birth. About a quarter end up in abortions and 15% miscarriages. If you guys can look at the graph to the right of the slide, so there's some age differences in between this 15 to 19 cohort, and the majority of pregnancies happen to teens that are 18 to 19 years old. So this also gives us an idea of when we should really be talking about birth control options, and that's generally the age they transition from pediatrics to adults. So if they can have an idea or be on the birth control of their choice before they leave a pediatric practice, that could prevent any unplanned pregnancies in that year or two after high school. So there is a lot of disparities in these rates. They can happen by racial, ethnic groups, by region of the country, socioeconomic status. The social determinants of health come into this, and you guys all know that is, you can look at it from a macro area, so country, state, city, community, neighborhoods, and family, and then at the end, it's that individual. So if you look at generally we look at the individual level way more than we look at the other levels, because that's the easiest one to talk about. But from an individual level, a lot of our teens might feel that there is not a lot of opportunities available to them to make a positive impact, so they feel that at least they can be a mom, and this could be one of the reasons for them getting pregnant early. We know that there's higher rates of teen pregnancy in neighborhoods where there is racial segregation, where there's income equality, and also within families that have poor income and poor education. Of course, it's not black and white. All of these things interplay together. We also know there is higher rates of teen pregnancy in teens who are involved with the welfare system. Teens who are living in foster care are more than twice as likely to become pregnant than those who are not. And it's also important to note that about 1 in 6 teen pregnancies are actually repeat teen pregnancies. So that's another area that we will talk about. So, and of course, it doesn't have to be, end of your life if you have if you're pregnant or have a child when you're a teen, but we do know that most teens who have a baby under age 18 don't end up getting a college degree. They take 4 or 5 years longer to get even their high school diploma. So we want to prevent any of this if possible, and then provide resources so that they are able to achieve what they would like. Next, we're going to talk about birth rates. So remember, this is that 61% of pregnancies that end up in live birth. So birth rate among teens is always also down about 65% since the 90s. And in the United States right now, we're sitting about 18.8 live births, but there's some disparities in that. So white teens have a much lower rate, and that corresponds more with some of the European countries, although they're even lower. They're usually below 10, versus our African American teens the birth rate is about 27, and our Hispanic teens, the birth rate is about 28, and our Native American teens, it's a little bit higher, it's about 32. So when you look at the overall ratio of all births in the United States, about 5% of babies are born to adolescents. But it's important to note that about 75% of these pregnancies in adolescents are unplanned, compared to about 40 to 50% in older women. So now we are going to look at where we are in different states. So as you can see, there's a wide variety, anywhere from 8 births per 1,000 females to higher than 32. I know most of you all are from the southern states, so in Texas, we are very red for sure. But even in Texas, there's disparities, and that will be on the next slide. So the official rate is 27.6 per 1,000, but there's a difference between urban and rural. Most teen pregnancies are, occur in rural counties compared to urban. So this is actually from the Texas Campaign website. You can look up any county and get a lot of good data and graphs. So we can see that the US is the orange line, so Texas is the blue line. Here in Austin, we are a little bit higher than the US rate, but we're below the rate for Texas. And then you can also see that the highest rates are in Dallas County, between Dallas, Houston, San Antonio, and Austin. So what does ideal family planning look like? So we would like to talk about reproductive life plan counseling, and this is probably the most important line out of this entire PowerPoint. Talk to both women and men, teenage girls and teenage boys, about what they would like in terms of having a family, having children, when they want to have children. It can be age related, it can be about school, where they are in their life, family, partners. When they come in for their general exams, we are usually talking about what do you want to do in the future, what do you want to do after high school. This question should be right up there. So we know that we want to talk to them about personal choice, and sometimes this can be difficult for providers, because we have to believe that patients know what is best for them, even if I don't agree with it, or we think that that's not the best for them. You have to be okay with their choices, giving them bodily anatomy, making sure autonomy, making sure there is no coercion. We would like everybody to have access to what the methods they want, clinics that they want. We want to be inclusive of LGBTQ population, our special needs teens that may be more street dependent. And then we want to make sure that there is full range of evidence-based FDA-approved methods available to them. Ideally, you want to use for those who don't want to have a pregnancy, you want to use the hormonal method and a barrier method. You want to make sure patients are aware of emergency contraception. And if they are pregnant, they don't want to be, that they have full pregnancy options. So probably when you talk about reproductive life plan counseling, it's important to even maybe write it down for patients. What are their goals about that? What are their values about that? We know that about 1/3 of high school students are sexually active, so reminding our youth that it is okay that if they don't want to have sex, that most people are actually not having sex, but that to allow them to have education if they choose to have sex. I'm going to hand it over to Elizabeth here to talk about some of the barriers to this ideal.
Alrighty, some barriers for teens: access, confidential and parental notifications, cost, misperceptions about their risk of getting pregnant, effectiveness and adverse effect of contraception, menstrual changes, fertility concerns, knowledge deficiency among adolescents and healthcare providers. So something I researched in some teens, things that they don't like about birth control methods, it's about any other method, not just one. Their menstrual cycle changes, and that's something that they don't like. They think by missing a period is affecting their body, or if it's a drug in their body. something that they do like about birth control. Obviously, it helps you prevent you from not getting pregnant. But something that something that they think about that they don't like still is that they don't help them from getting sexual transmitted infections. And obviously, they look for something that helps you prevent that. Another thing I researched about is that something that they do like about it helps you with hormone levels. And then a main thing that I did research is the cost. Some women cannot afford this type of birth control. It's either not them having insurance.
So when she says she did research, she went and talked to a lot of friends and family. That was Elizabeth Torres. She's one of our medical assistants here at Peoples. So we asked her to get out and talk to her friends, talk to her family, and see what are some of the concerns that they have. So that's what she's talking about when she's giving those concerns. And we wanted her to actually talk about it because that's what we hear from our patients, those exact concerns. Thank you, Elizabeth. So many people ask, can a minor consent for birth control? I know that in my former jobs when I was working with teens on the streets who didn't want a pregnancy, I was unaware of all the ways that someone could consent for birth control or find resources. So they can consent for birth control, but it is kind of, it takes a little knowledge and information to be able to know where to go and how you can get around that. So in 21 states and the District of Columbia, all minors can consent for contraceptive services. In 25 states, they permit minors to consent to contraceptive services in one or more circumstances. So it's not under all situations. And then there's 4 states that have no explicit policy.
So it's important to note this is for actually receiving a contraceptive method. Mm-hmm. You can talk about it with teens in all states privately. So talking about it does not need parental consent.
Counseling does not need consent. But there is an exception to every rule, and this is one of them. Youth under 18 need consent from a parent or guardian or other authorized adults to access birth control. But there is a couple of ways that they can get around that. One is minors can get confidential reproductive health care services at Title X clinics. And under the law, they can also use Medicaid to consent for their own family planning services if they have Medicaid. And then Texas youth who are under 18 are allowed to consent to most of their healthcare services if they're married, emancipated, or serving in prison or in the military. I have encountered quite a few youth who are living on their own and managing their own finances, but they're not emancipated, or they're not, there's a parent somewhere but not present in their life. And for those, we can also find ways to go around. But anyone can buy over-the-counter methods like condoms and spermicide or emergency contraception. So is there financial assistance that will cover birth control? Yes, there is. One of the things that Elizabeth mentioned was the worried about paying for it or if you're uninsured. So we've given you a breakdown of the different programs. Medicaid, which we already said, can be used for family planning services. It's typically for low-income children, pregnant women, and Medicaid is for those with legal residency status. There's also the CHIP, Children's Health Insurance Program, and that is citizenship requirement as well. But some non-citizens can get it, and that includes the CHIP perinatal program, which covers the pregnancy for those women. And the last one is Title X, which is the kind of aha for me after I worked with a lot of ladies who didn't qualify for Medicaid or didn't have CHIP. Then This is federal funding to clinics for reproductive health care with sliding scales, no citizenship requirement, which is the biggie, why it's underlined. It's for men and women. And minors can access confidential care in Title X clinics. So sometimes we have a young lady come in with her parent, and we always have a time to talk to the teen without her parent in the room. So then we have a chance to say, was there anything else you wanted to talk about? And we can do a confidential visit within a well child visit, and none of that is documented in the patient's chart. So funding for birth control, state and local, there's the Healthy Texas Women. If someone is under 19, they should be on Medicaid and not on Healthy Texas Women. And then there's family planning and local. And we are a federally qualified health center. So, and many other places, there's people who receive different funding that would cover that.
All right, so we've been talking about Title X a lot. So what is Title X? It's actually been around since 1970. It's administered through Office of Assistant Secretary for Health and Office of Population Affairs. The big thing is it's confidential, it's free or very low cost. It covers family planning, STI services, cancer screening such as pap smears, and there are locations in almost all states. You can see more information. This is from 2017 about the 89 grants, and there's close to 4,000 service sites across the US. So majority of patients who access Title X services are women, about 9 out of 10. Majority are under age of 30. Majority are actually minority, but there's a lot of majority are actually white, but there's a lot of minority that population that access this. And it's, again, open to men and women. And it's important to say that about 90% actually qualified for no charge services or subsidized services. So for example, when somebody comes in, if they're a teen, they have no income and they want to get an IUD, that is actually free. Or if they want to get an implant, it's actually free. And majority of our birth control options, even for somebody who has an income, ends up being under $100. The average is about $50. So we mentioned some of the locals resources. So what is the difference between Healthy Texas Women and Family Planning Services? So they cover a lot of reproductive health, some medical stuff, so screening for cholesterol, diabetes, high blood pressure, as well as postpartum depression. You can access their website, get a lot of more information. They have online tools, help you find a clinic. There's multiple ways to apply. And the services, if you qualify, services are free. So what's the difference between that and the family planning program, which is offered through the same system, is there's no postpartum depression here. The most important thing is this is open to men and women. So if a male wanted to get STI screening, they could under this program. They do not have to be a citizen. There's online eligibility, but they have to apply in person at the clinic. So for example, if this can supplement CHIP, remember CHIP in Texas does not cover birth control for family planning purposes. So let's say a 16-year-old is coming in with their mom, they have CHIP, but they want birth control, and their mom is okay with it, they're consenting, they can get it for low cost under this program. But it does require parental consent because it's offered through the state. And there's usually a small copay that can be associated with it. So most important thing, where can you find a clinic? So Texas Campaign has a great tool. It's a clinic finder. You can put in your zip code. It will find Title X clinics, FQHCs, any number of programs. You can share this with your patients. If you're counseling them and they're asking you about services, you can sit with them, pull up a clinic, give them the address, and then they can go in and see what they qualify for. So this slide, again, just giving you a different overview. If they're 19 or under, what are the funding resources available to them? If they're 19 or older, what is available to them? So we've been talking a lot about confidential visits, so what does that entail?
I think it's important to point out that you don't have to know all these programs and all the ins and outs of them, because many of the federally qualified health centers have people on staff that will help you navigate them and help apply for multiple different programs so that some parts are covered and other people may not. And remember that you can use the question and answer button to ask questions about any of this, because we know it's a lot of information. And we want to hear what your thoughts are or concerns, or what things you've encountered using these services. So one of the big pluses to a Title X clinic is being able to provide a confidential visit. And as you remember, that was also under Medicaid for patients who have Medicaid. If a visit is marked as confidential, it is kept secure so that only staff can view the documentation. And I put that little confidential stamp at the bottom because that's kind of what it looks like in the patient chart. So if we decide that a patient wants to have a confidential visit, that means that nothing will be mailed to their house about the services, they won't be billed, their parents won't find out. And it also labels the chart so that if someone calls and asks questions, even if they have access to that patient's records, they would not be able to access that confidential section. So typically the patient wants to discuss birth control or STI testing without their parent knowing about the visit. And like I said, there's no paper trace. We double check which phone numbers to call so that we're not calling the parent regarding the follow-up from this visit. It takes a lot of teamwork from all departments in the clinic, and including lab and the providers and the health educators and the nurses. It keeps us on our toes, but it's definitely one of the bonuses to the Title X and the Medicaid confidential visits. So how do you start the birth control conversation with a teen? The answer is don't ask what birth control do you want, but instead go from the reproductive life plan, like Selena was talking about earlier, asking patients what are their future plans and what have they heard about birth control and what their friends are using. I like to kind of navigate what their hopes and dreams and goals are, their current living situation and stability, what their education dreams are, and then on a scale of 1 to 10, how important is it to you to prevent pregnancy today? And I always say, with 1 being I want to be pregnant, and 10 is I don't want any kids right now. Or, some of them come up with a 15. So I know where they're at, and it helps to guide the birth control conversation. There's a really cool website that has counseling tips for teens. It's called envisionsrh.com. We've put the website there, the link. So it has cool ways of trying to talk about difficult conversations, like using rephrasing. Whenever they are talking about something, you're kind of repeating and rephrasing what they're saying to help them hear what their concerns and worries are. Always using open-ended questions. My team and I like to use motivational interviewing, so not making any assumptions and always getting the patient to talk more than we're talking. And then at the end, having a teach back. And that is important because sometimes they come in for, they need something for STIs, they need something to prevent pregnancy, and they might need some emergency contraception as well. So it takes some teach back to keep those things straightened out. And then I like to do on one hand, you're saying this, and on the other hand, you're feeling this, because that's what we encounter a lot with teens is, on one hand, I want a kid, but on the other hand, I want to go to school and I want to graduate college and not do it like others in my family have done. So this is just a great website with counseling skills.
I think it's important to meet patients where they are. So if somebody comes in and all they're asking you is for condoms, that's okay. Just show them resources where to get free condoms, where to get testing, and leave that window open where if you want to talk about anything else, we are here to talk about it, and allow patients time to get comfortable with you, allow them time to sort of get comfortable with coming to terms with everything else they've heard from their family, friends, online, and what you are telling them. And it's okay to take their time.
This is my favorite tool that my team and I use after we figure out where the patient is and what their wishes and desires are, that it makes it really easy to talk about what's the best method for them to be able to take charge of their life and take control of the situation. So if someone says, I'm a 10 out of a 10, then I would start with, well, it sounds like you're on this top row and you are interested in preventing pregnancy as much as possible, and you are not interested in any accidents, so less than 1 in 100 women, and that covers the IUDs and the Nixplanon. But if somebody says, I'm like a 5, I'm not sure, I'd be okay if I was pregnant, then I would say, look at this middle row, because that is, they're not bad methods, but we're all humans and we all make mistakes and forget or don't make it into the pharmacy to pick up our prescriptions. And then for those who say, I'm okay with getting pregnant, then we use the bottom row to talk about STI prevention.
All right, so when we talk about different contraceptive methods, there's a lot of ways you can categorize them. And sometimes patients, if you only talk about this works best, this doesn't work great, that's not what they want to hear. So you have to find which categorization they're interested in. So we can talk about what has hormones versus what has no hormones. What is low maintenance, you set it and forget it, versus what is something that's we call user dependent, or you have to remember to do stuff for. That could be either taking your pill, getting a refill, making an appointment, all that. What requires a prescription versus what that can be purchased just over the counter. What are the ones that allow you to have regular menstrual cycles, your periods won't be affected, versus those that will get rid of your periods. And then what is prevention versus what is, okay, well, I did this, I still don't want to be pregnant, what do I do? So emergency contraception. So some of the different methods, so when we talk about hormones, we have 2 major types. One is progestin only methods, and usually the main mechanism of action for them is by thickening the cervical mucus. They do have some effect on ovulation, but mainly it's thickening of cervical mucus. And it's if somebody's breastfeeding, these methods, so the Nexplanon, the progestin IUD, progestin pills, and the depot shot are actually safe. They will not affect the milk supply. Then we have the combined estrogen progestin methods. So we know that pills are the most popular form of birth control, but they end up not being the most effective. Less than half the patients that actually start with pills end up being on them after 6 months to a year. But they are, if taken correctly, they do suppress ovulation. So the combined hormonal contraceptions come in different forms. There's pills that you can take monthly. There are pills that you can take 3 months at a time. There is the NuvaRing, and then the contraceptive patch. And then there's various non-hormonal options. So different types of barrier methods, male condoms, female condoms, cervical caps, diaphragms, all those. And then the copper IUD, which can also act as an emergency contraception. It changes the milieu of the uterus, so it's not a hospitable place for implantation. So a quick word about emergency contraception. There's 3 that are available in the United States. The bottom row, the Plan B, is the one that can be, that does not need a prescription. Anybody can buy it at a pharmacy. You have to ask for it in a lot of pharmacies. generally within, as all of these are as soon as possible, they work best, but for the Plan B one step, it's generally 3 days. And there's a weight limitation to the pills, so they don't work as well in women who are over 200 pounds, and they need to we need to make sure they have a repeat pregnancy test. Then Ella is the other emergency contraception that needs a prescription. You can take it up to 5 days, but again, works best taken as soon as possible. Both of these pills prevent or delay ovulation, and that's the way that they prevent pregnancy. And then the copper IUD we talked a little bit about before, that does not have a weight limitation. It's almost 100% effective, but can also needs to be used within 5 days. The benefit of that one is if you get it, then it also works as a contraceptive method that's can last up to 10 years.
I noticed that several of the insurance plans don't cover emergency contraception, but Title 10 does. And like Selena said, you can buy Plan B at like local grocery store or CVS, but it is expensive. But if you come into Title 10 clinic, then it's covered, usually super duper cheap or free.
And a lot of times, even if our patients are not ready for starting a method, we just give them, they leave our clinic with a Plan B or Ella in hand so that they have it available to them if they happen to have unprotected sex, and they don't have to worry and try to rush to clinic for that. So you guys have seen this chart. Now I'm going to talk a little bit about the different methods. Again, we start at the top. These are the what we call the LARC methods, the long-acting methods. They are the most effective, but they are the least utilized. So in terms of society recommendations, the American College of Obstetrics, American Academy of Pediatrics, American Academy of Family Medicine, they all recommend the IUD or the implant as the first line birth control for teens, as well as anybody else, just because they're effective. A lot of times what we hear about our teens, they say to me, oh, well, I'm responsible, I can take the pills. It's not about being responsible or not, it's just about what's most effective. So for the teens that do choose to use an implant or the IUD, actually more than 80% of them stick with it, and they don't discontinue it. They like using it. So again, they're private. They last from anywhere from 3 to 12 years. The most common side effect and the most common reason people will choose to discontinue is changes in the menstrual cycle. So either heavier bleeding or bleeding for longer than 7 days, or sometimes just having irregular spotting. Most of this is okay as long as you talk to patients about that. They understand that that's one of the side effects. You troubleshoot with them how to manage those side effects, and just because you have a side effect doesn't mean your method is not working for you or that side effect cannot be managed. Then the next row, so these are your combined hormonal pills, the pill, the patch, the vaginal ring. All of those need a prescription. Generally, we can give a prescription up to 1 year, but I'd like to follow patients up frequently, at least when we first start, making sure that they are taking it, they don't have any problems with it, they like to stick with it or change to something else. With the pills, again, this is important to remember, the pills, they can start the same day that they see a provider. If they have a negative pregnancy test, there is no need to wait until a Sunday or until your next period. You just start the same day, and that goes for any of these methods. The Depo-Provera shot needs to be given every 13 weeks. Most women will not have any periods on that after 6 months of use. There is some concern about decreased bone mineral density with Depo. However, in clinical practice, it does not mean that people will end up getting fractures. That bone mineral density is reversible, so it is safe to use. And then finally, the bottom one is the barrier methods. And we're not going to spend a lot of time talking about those, but we do recommend that even whichever hormonal birth control patients are using, that they do use a condom or type of barrier method with it.
So if you want to learn more about birth control options, we found a list of teen-friendly, fun, and accurate information. I know most of our patients find information on YouTube, so I like to provide them with better sources. Bedsider is a great one, and that's where we got the effectiveness chart as well. There's videos and other visual aids to help people compare methods and hear about other people's experiences. And Stay Teen is really fun. It feels like it was written by a teenager, and there's little animated scripts and little quizzes or Quizlets, they call them, where you can see which birth control method is best for you. And then Young Women's Health has general information about women's health with birth control specific information and a way to chat and ask questions. And NERCS is one of these new sites where you can actually order birth control and have it delivered to your door. They also can send you HPV home screening and you mail it off, for HIV, PrEP, emergency contraception. It's really cheap, but you don't need coverage to do it. And then Planned Parenthood has two resources that we like to use a lot. Introducing Rue is a way to chat and ask awkward questions about sexual health, relationships, puberty, things like that, with where you know that you can get information from a medical provider. And then Spot On is a way to track your period. And there's also some, like, if a patient wants to take the OCPs or pills, then it reminds them to take the pills. And then, of course, Jane's Due Process is an amazing resource to help teens who are interested in receiving a judicial bypass, finding an abortion clinic in Texas. But it also has where can I get birth control and emergency contraception with a free text line to ask questions as well.
All right, so a few take-home messages. So all of these information, the slides and lots of data, graphs will be available to you through the Texas Campaign website. Remember to talk about that reproductive life plan with both girls and boys and start early. Make sure that you're not afraid to talk about IUD and Nexplanon. They are the most effective, most safe methods for teens. And if you can find a Title X clinic near where you are, that's a great resource to refer patients to. So this concludes our presentation. There are some extra slides in the appendix with more detailed information about specific methods that you can review. And I think we have a few minutes for questions.
And remember that you can use the Q&A button on the bottom of your screen if you have another question that you'd like to ask.
Okay, so we're gonna go through some of your questions.
So one of the questions is, can we give out condoms to adolescents 18 years or younger without parental consent? And the answer is yes. We have them in our bathrooms and we give them away to anyone who says that they're interested in using condoms. The number one way to prevent unplanned teen pregnancy is giving people access to resources like condoms.
Okay, so how would you approach in a situation where a teen is asking you questions about sex and contraception, but parent is in the room and is uncomfortable with the conversation? So normalizing this starts early. So generally, we start from age 11 to 12 talking about body, puberty changes, and correct anatomy. And we do that conversation with parents in the room to make sure that they hear the same information and take away some of that awkwardness. And, we ask about sex and contraception without the parent in the room. So inviting parents to step out, that allows you to have that conversation with the patient, and just make it a regular part of your practice. So even if they're coming in and they're 12 and you know they're not having sex, nobody's thinking about that, just invite the parent out so that they get used to that. And another way we promote it is we say, you know, patients generally, or your children, rely on you to speak for them. We give them this time so that they can get comfortable speaking to doctors and getting some more autonomy. And most parents are okay with that. What about concerns from women regarding movement or dislodgement of IUD? So the number one would be referring them to an experienced provider. Most IUD complications happen when there are inexperienced providers placing them. Movement does not really occur if it's within the uterus. It's within the uterus. There's not a whole lot of places for it to go. In terms of expulsion, so meaning the IUD coming out from the cervical canal, extremely rare, less than 10%. Most of them occur if they're placed too early after giving vaginal birth. And again, making sure that they are placed correctly. If there's a concern, an ultrasound can always be done while placing an IUD or afterwards if there's a patient concerned and they don't know if their IUD is intact or not.
So another question was, how early can the next depot shot be given? Can you give them early?
So we can give them a couple of weeks early. If technically even like a month early, it's not going to cause a whole lot of problems if there's a travel related issue. So that can be dealt with on a case-by-case basis.
So can you explain when one could expect their normal period after taking emergency contraception? I usually tell women that it sometimes will create them to bleed or spot or have a period, but by the next month it should all be normal again. Is that right?
Right, and we always encourage patients to call and ask if, you know, after it's been 6 weeks and you're not getting a period, come and talk to us. We generally would like them to have a repeat pregnancy test after taking an emergency contraception about a week after, just to ensure that it worked, because again, it's not 100% effective.
See, I think we have more questions, but we can't see them. There they are.
Are there certain brands of IUDs better than others for teens? So Liletta and Liletta is essentially the same as Mirena. Skyla is marketed to women who have not had children yet. The inserter is a little bit smaller, but it also lasts for a shorter amount of time. In practice, we don't really offer the Skyla because if you're going to do the procedure, the difference of insertion is really not that much. So if you can give somebody 2 or 3 extra years of protection, just doing the Liletta or the Mirena is better than the other ones.
And of course, it's whatever the best IUD is, the one that fits their goals and their reproductive life plan, and it's not so much the specific ones. So there's another question about how have we navigated the weight gain concern, especially with teens. I can think back to my time as a teenager and understand how big of a concern this can be. Yes, we definitely get that question a lot, and in huge studies of Nexplanon, there is, a slight change in appetite is the way that it's described, and not necessarily a change in weight. And so we always talk to patients about how they're eating and taking care of themselves and making sure that, they're being as healthy as they can be. And if they have concerns or questions, if they feel like they're gaining weight, that they can, of course, come back and talk to us about it, and we can see about switching to another method or trying something different. But that weight gain with Nexplanon is not typically a huge issue for women who are healthy.
And the most commonly when we see weight gain is associated with Depo-Provera.
Yeah.
But again, it's not in everybody. And like Taryn said, we just talk about, okay, what are your concerns with your weight? Let's work on other ways to make sure that you are at a healthy weight, you're exercising, and you're eating well.
And I think the last question, maybe Jen is good for it. Is there a legal barrier for confidential visits in a non-Title X clinic? As an FQHC, can we perform them? And the answer to that is through Medicaid, confidential visits are available. Is there something else?
So, and this is Jennifer Biendo with the Texas campaign. I think that what I would add to that is that clinicians can talk to adolescents and counsel them in any way that they feel is appropriate. So an FQHC could certainly counsel a young woman on contraception and information. The issue is if they're not in a Title X clinic, they would need parental consent to actually prescribe the contraception. But they could certainly counsel them about over-the-counter methods or tell them to go to a Title X clinic to acquire the method. And Texas law, even in the situations where teens can consent to their own medical care, Texas law actually allows the clinician to speak to the parents about the care provided. So outside of a Title X clinic, confidentiality is not actually guaranteed.
But that's up to the clinician. So you don't have to, but if you think that's in their best interest, you can. And we always encourage patients to talk to their family. We offer them help. Like if you want to talk to your family, you don't know how can we do it together? These are examples, because the more support they have and the more family involvement they have, it's going to be better long term. So that's also some of the conversations, is helping them get their family on board to help with their goals. And going back to that first slide, remember the majority of teen pregnancies are in 18-year-olds. They don't need any parental consent, so it's just providing them with access.
All right, thank you again for being with us this morning, and stay tuned for information on future webinars. As a reminder, slides will be shared via email later today, and they'll also be put on our website at txcampaign.org. And finally, please complete the brief evaluation that we will email to you here in a bit. Those seeking continuing education credits for social work must complete the survey to receive their certificate. Thank you and have a great day.
Thank you.